is our TA and Training Planning and Development Consultant for the National Hispanic and Latino ATTC, and I will tell you a little bit more about him later. During today's webinar, all participants will be muted. The audio will be streamed to the computer, so please make sure your computer speakers are turned on and up to hear today's presentation. First, I'm going to review a few housekeeping items with everyone. If you notice that your viewer does not fit your screen, you can expand it by clicking the expand button located in the top right corner indicated by the red arrow. Now you'll see that your viewer is expanded to fit the entire screen. Also, you can collapse the GoToWebinar toolbar on the right of your screen by clicking on the small red arrow on the left of the toolbar. And then click the arrow again to expand the toolbar, and it will expand. For today's webinar, all participants will be muted. As we move through the presentation, if you have any questions for our presenter, we ask that you use the chat box on the toolbar. Simply type your question and hit send. We can pause for our presenter to address any questions at an appropriate time during today's presentation and again at the conclusion. So if you have any questions, go ahead and write them on the chat, and we'll be reviewing them so we can share them with the presenter. Also, a recording of today's webinar along with the PowerPoint presentation slides will be available at the National Hispanic and Latino ATTC webpage, which you can see on your screen. Approximately a week from today, simply go to our webpage, and under Training, Education, and Outreach, you can click Webinars and TOTs, and you can also find recordings and PowerPoint presentation slides from previous webinars. One NADAC, NBCC, and ICRC continuing education credit is available to those who attend today's live event. So if you're interested in obtaining CEUs from these organizations, you may email us at hispanic@attcnetwork.org. Today's webinar is sponsored by the National Hispanic and Latinos ATTC. As of October 1st of 2012, as some of you may know, the network has been restructured and now consists of 10 regional ATTCs, 4 national focus areas ATTCs, along with the network coordinating office. As you can see by this map, the ATTC network regions were realigned to better fit the current HHS regions. And the 4 national focus areas ATTCs, you can see that are listed on the left. Today's webinar is the third in a series that the National Hispanic and Latino ATTC will be offering. The ATTC network is funded by SAMHSA and serves a critical role in improving the health of our nation. The network achieves this by translating, disseminating, and promoting the adoption and implementation of evidence-based clinical practices, and strives to improve the health and wellness of individuals whose lives have been impacted by the disease of addiction. You can learn more by going to SAMHSA's webpage. SAMHSA strives to reduce the impact of substance abuse and mental illness on America's communities through its program and services, and demonstrates that behavioral health is essential to health, prevention works, treatment is effective, and people recover from mental and substance use disorders. Now I'm going to be telling you a little bit more about our presenter. Victor Flores is originally from Nogales, Sonora, Mexico. He possesses a master's degree in counseling with an undergraduate degree in sociology. His experience has allowed him to be in various positions within a multiplicity of systems, including courts, behavioral health, and other nonprofit organizations. Currently, he provides assessment, screening, and ongoing treatment to specialized populations. He possesses a license from the Arizona Board of Behavioral Health Examiners in order to deliver services in Arizona. The services are responsive to the culture and to the linguistic needs of those he serves. He has offices in Phoenix and Tucson. He is the TA and Training Planning and Development Consultant for the National Hispanic and Latino ATTC, which includes training and workforce development in the area of cultural competency for the center.
Now we're gonna do some poll questions in order for us to know our audience. We're gonna start by our first question. Participants of the webinar will be able to answer these questions, and I'll leave a window open of about 10 seconds so you can answer the poll questions. And I'm going to start with the first question. It says, are you planning to serve Hispanic and Latino populations with substance use disorders within the next 6 months? I'm going to close the poll now. 61% voted, 92% voted yes, 8% voted no. The second question, do you currently serve Hispanic and Latino population with substance use disorders? All right, 92% of the people has answered yes. I'm going to close the poll now. The third question is, what is your current professional role? %54 has answered other. Now I'm going to close the poll. And the fourth question, what type of setting do you currently work in? All right, about 60%, 50% of the people work within the substance use disorder treatment, inpatient and outpatient. I'm going to close the poll now. And the last question, which field of work do you represent? All right, 43% of the participants has answered mental health. Now I'm going to close the poll question. Thank you very much to all of you for answering these poll questions. Now I'm going to turn over the presentation to our presenter, Mr. Victor Flores. Enjoy the presentation. All right, Victor, you're now the presenter. Victor? All right. We're seeing your screen now. All right, Victor, can you hear us?
Okay.
Now I can.
Okay.
I mean, now you can hear me, I think.
Yes, I can. We can hear you now,
Okay.
loud and clear.
Perfect, perfect. Welcome, everybody. I want to just briefly say, I think my colleagues already gave an introduction around what we're going to be needing today and doing today. But I want to welcome everybody to this webinar on the Enhanced National CLAS Standards. I want to make sure that everybody understands that, you know, those that are present, we're basically participating in a session, if you will, that is information that's newly rolling out for the most part from the Office of Minority Health, and the enhanced CLAS standards. Although the CLAS standards aren't brand new per se, the information we've got is so new that when you get on the Office of Minority Health website, you'll see that you'll find a blueprint that it's dated April of 2013. So that's just a month ago when these enhanced CLAS standards were finalized. So it's exciting that we're in a position to be able to talk about this crucial element in which it impacts the way in which we provide, or providers are responsive to those we serve. So I just want to put that out there. In addition, today's structure of the webinar, usually I take questions about halfway through and then at the end, but the thing is, as questions come in, I'm sure we can answer them depending on how many questions we receive. So I just want to put that out there. So there'll be some information shared today. So let's go ahead and just begin with the presentation itself. One of the things that we oftentimes talk about when we start talking about CLAS standards, cultural and linguistic appropriate services standards, are health equity. The highest level of health for all people currently, individuals from various backgrounds that are unable to attain different equity, and disparities is the word that usually comes up. And a lot of this is due to things such as social detriments of health, conditions in which people are born, in which people grow up, in which people live, how people work, how people age. And it's important to also include such items such as socioeconomic status, education level, availability of health and services. These are the things we oftentimes talk about when we start talking about cultural competency, cultural diversity, cultural responsiveness. And it's important that when we start saying, how CLAS standards came about, that's part of the discussion. In terms of health disparities, some of those things that come to mind are that there's issues such as race and ethnicity, religion, socioeconomic status, gender, age, mental health, cognitive, sensory, or physical disability, sexual orientation or gender identity, geographic location, or other characteristics historically linked to discrimination or exclusion. These are some of the things that have been obstacles for some due to some of the reasons that I just mentioned. So as a result, the Health and Human Services created what we call the Healthy People 2020 initiative. And although this, again, isn't new, there have been 4 prior initiatives prior to this in 79, 90, in 2000, and 2010. And according to this, the premise really is health equity. And when we start talking about health equity, we start talking about things to just even the playing field, to make sure that everybody is receiving services that are really going to improve their lives and help them out. So when we start using such words as health disparities, and as you can see, a couple of the bullet points up here are, how they affect the quality of life of individuals, the high cost. Well, we start looking at how health disparities adversely affect neighborhoods, communities, and the broader society, thus making it not only an individual concern, but also a public health concern. In the U.S., for example, as far as costs in the U.S., it has been estimated that the combined cost of health disparities and the subsequent deaths due to inadequate and or inequitable care is around $1.24 trillion. That's pretty significant. And again, in terms of different systems that are serving people, this is a high cost, and in the long run, it impacts everyone. One of the things that we oftentimes talk about are some of the things we can do about service delivery, about doing things. So that's where we start the discussion on culturally and linguistically appropriate services. And some of those issues, such that I just mentioned, we can modify some of the way we respond to this. And that's one of the things it says, modifiable factors. And these are factors that can be changed or at least modified to make sure that we are doing things maybe a little differently. So when the discussion ensues around the CLAS standards, we start talking about in the year 2000 when they were rolled out. And basically, when we start looking historically at the CLAS standards, you know, they recognized the Office of Minority Health, the need for something to be done because they recognized the increase in the diversity of those we were serving in the healthcare field. We also identified the need to improve service delivery and do things a little differently or at least a little better. And there was a need to find a comprehensive approach and a comprehensive way to put together standards for organizations and providers that needed and wanted guidance on how to provide cultural and linguistic services in health care settings. So these were the types of things that were just so important to everyone that was trying to be doing not just the right thing, but the things that allowed them to do the providing of services appropriately, adequately, and efficiently. So what ensued from 2010 to about 2012, there was this continued awareness of that the changing demographics, the landscape was changing, and part of that was the tremendous growth in many fields, including the fields of cultural and linguistic competency. So over the past decade, and this was what was happening out there, was ensuing, and part of it wanted to make sure was that there was more relevance with a new approach to these national policies and legislation that were rolling out, that were actually recognizing this is what we need. So part of that really was to look at the things that had been done in the past and use that as a framework, as a baseline, because the original CLAS standards had 14 standards that were placed into different, if you will, themes. And as you can see there at the bottom, those themes were mandates, guidelines, and recommendations. And although these served as really positive points and by some organizations as templates for the development of cultural competency or cultural proficiency plans, this was a great starting point for many of the organizations that were out there. So that brought us to the more enhanced, or if you will, the enhanced CLAS standards that were a little bit more detailed but were more advanced in terms of how to pursue some of these really big endeavors. So currently what we're talking about is there's 15 standards with 3 broader themes, and here what we decided to do in terms of how to present it is put it into the 3 themes and then go each one to make sure that we don't miss out on any of them, because the thing is, as they're categorized, we want to make sure that they apply to everybody, because one of the things that we've been talking about quite often is that these are relevant to everyone, but most and foremost are to those that receive federal funds. And that's one of the things that was a mandate for some of those linguistic around mandates around interpretation and translation. So currently there are 15 standards, and they fall into the 3 themes of Theme 1, governance, leadership, and workforce. Theme 2, communication and language assistance. Theme 3, engagement, continuous improvement, and accountability. And this is really a powerful piece in that what it is, again, it serves as a guideline, but now that we're further down the road in terms of cultural competency and cultural responsiveness, we know that some of these need to get a little bit more detailed for what we require in our different work environments. So therefore, when we start with the principal standard, number one, to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. This is a big general standard where basically it's about meeting someone where they're at. And it's part of the overarching idea of providing services in culturally responsive ways. When we actually get into the themes, we start looking at the governance, leadership, and workforce. And we're talking about standards 2, 3, and 4. And 2, advance and sustain organizational governance and leadership, that promotes class and health equity through policy, practices, and allocated resources. This is part of making it an essential piece of organizations and their structure. In the past, one of the things that would occur oftentimes is organizations would include cultural competence as an afterthought, as something that wasn't the first thing on the agenda, whereas part of this is that it could be part of every piece of any plan going forward. Number 3, recruit, promote, and support a culturally and linguistically diverse governance, leadership, and workforce that are responsive to the population in the service area. You know, part of building a workforce with the necessary elements that has the above mentioned inculcated is really important, because part of working within this structure is those line staff, those managers, they will be the leaders of these different organizations, and to go forward in ways that are responsive to everybody that's being served is essential. 4, educate and train governance, leadership, and workforce in culturally and linguistically appropriate policies and practices on an ongoing basis. You know, this can be a moving target in that what we want is to make sure that we have work put into the development of these skill sets to make sure that as we grow, we know that there's a changing terrain, a changing diversity, and that we're able to do such a thing. Make it a way of functioning, not an addition or another thing we have to do. I mean, oftentimes in every setting, whether it's education or mental or behavioral health, oftentimes we are given different chances to improve or increase our skill sets around different areas, whether it's medicated assisted treatment, whether it's, you name it. It's different things that we can increase our skill sets in. Communication and language assistance. You know, this is one that's really something that is looked at as not just crucial but necessary. And again, this has to do, and oftentimes we'll hear about 2 words in here. We'll hear about interpretation and translation. Interpretation, the spoken word. Translation, the written word. And oftentimes in this one, as you can see, number 5, offer language assistance to individuals who have limited English proficiency and or other communication needs at no cost to them, to facilitate timely access to all healthcare services. You know, part of this, again, has to do with how do we know when we offer these things? Well, in the past, there were different things that were out there to ensure that people receive services, and one of those things that some states went to were adhering to what they call threshold languages. And threshold languages are something that where it's a minimum number of individuals, usually defined as patients, members, enrollees, or the service population, that identify a non-English language as their primary language. But some agencies started kind of shifting because that was pretty hard and fast, and say this is a threshold language. LEP groups that equal 5% or more of the population served by a local office of the state agency, for example, county health department, etc. So a way to kind of work with that and not necessarily say a threshold language were different descriptions. And one of those descriptions was called a safe harbor. So it's not as direct as a threshold language, but a safe harbor is oftentimes the verbiage used around how to deliver services. And a lot of times what this means is having a translator or an interpreter available. In addition, if a person isn't there to do that, having workers that have the capacity or the availability to provide such services. Number 6, inform all individuals of the availability of language assistance services clearly and in their preferred language, verbally and in writing. And again, some places will say, well, we don't have enough people to consider ourselves having to deliver services in that language. But many times, some will seek out different things, whether it's written materials or what we call universal signage. So signs that are basically pictures more than they are anything written. And that is oftentimes referred to as universal language. Ensure the competence of organizations providing language assistance. Recognizing the use of untrained individuals and or minors as interpreters should be avoided. You know, having been one of those children that used to interpret for parents, that's one of the things that we definitely want to avoid. And a lot of agencies in the past have said, well, don't worry, we have a relative of so-and-so coming in, and they'll just serve as the interpreter. And many times, this is not just something that anybody can do, and it's really a difficult task for a child to be talking about adult-oriented things. So those kinds of things are really things that should be avoided. Many times, some organizations will use proficiency exams with their language speakers to ensure that they can convey information in the language that they're being utilized in. So if, for example, a Spanish speaker is hired to do in case management, and all of a sudden they're called out to work with Spanish language clients, one of the things that occurs is some agencies will test the proficiency of this person to see how able they are to provide languages in that particular, in Spanish. So those kinds of things are crucial. 8, provide easy to understand print and multimedia materials and signage in the languages commonly used by the populations in the service areas. Places like California or other large cities with populations that are very diverse oftentimes have different languages for which they have to provide printed material and interpreters, and because of this they have to be prepared to do these kinds of things, whether it's 15 languages for which they have to provide services or 1. But these are some of the things that when an agency receives federal funds that which they have to be cognizant. In terms of engagement, continuous improvement, and accountability, you know, a lot of the standards in the area have to do with service delivery, have to do with providers and organizations really focusing on how to deliver appropriate and efficient services. And this is almost part of not just accountability, but also a piece of being able to put a plan together going forward. And for example, 9, establish culturally and linguistically appropriate goals, policies, and management accountability, and infuse them throughout the organization's planning and operations. That goes without saying. One of the things that are the most important is not to make this an addition, but rather if these kinds of practices are infused throughout any plan that any organization puts forth, then it becomes not just a way of improving, but also a way of delivery, a way of going forward. So it's not a specialty area, but rather an area in which the organization can do business with everybody. 10, conduct ongoing assessments of the organization class-related activities and integrate class-related measures into measurements and continuous quality improvement activities. You know, whether the IT department or whether it's about delivering services in warm, friendly, inclusive ways, both of those can be captured. And if the organization is serious on how to go forward with this, different things can be done to ensure that this is happening. Things such as secret shopper, where somebody can go in and if an organization says, yes, we deliver these services in Spanish at our clinic on the south side, then a secret shopper to ensure that the front desk person is qualified to answer questions in Spanish for this clinic that might be delivering services in that specific language. And that's just an activity. Or even identify a person within the organization that is in charge of the cultural or class-related activities within the organization. Just a couple of recommendations. 11, collect and maintain accurate and reliable demographic data to monitor and evaluate the impact of class on health equity and outcomes and to inform service delivery. Now, again, this is another one that's not just about accountability and responsibility, but if we're saying that we have a certain percentage of our workforce that is of a has a certain skill, we want to make sure that this is the case. Or if we're recruiting those folks that have certain skills, what are we doing to ensure that they stay within the system? Because, for example, sometimes organizations end up fighting for the same people, and next thing you know, they'll go for the one that works the best. But the thing is, as it is, there's a shortage of people in the human service field. Now, to find people with different skill sets that can be applied, how do we retain them? How do we keep them? So to collect this information and keep it accurate, it's crucial. Now, if we're looking at making sure we're saying, hey, we're providing this amount of interpretation services for these amounts of people, then we need to make sure that we're getting that information. Because if we're hiring interpreters for a clinic where a certain portion of our population is not going, then why get interpreters at that location and put them where they need to? Here in Tucson, for example, one of the things that I oftentimes wonder or have paid attention to is if the majority of the Spanish language clientele is going to the south side and the west side clinics, how do you put the majority of your interpreters on the east side or on the north side? Not that that happens, but just it's to make sure that we're responsive where we need to be responsive. And a lot of times the data we collect helps us to ensure that that's what's happening. 12, conduct regular assessments of community health assets and needs and use the results to plan and implement services that respond to the cultural and linguistic diversity of populations in the service area. You know, some of the things that we oftentimes have to look at is almost all the services we deliver are done in a strength-based manner. We're always looking for strength-based things. Well, in many of the communities we work, we want to make sure that we're getting that information coming in our direction. So to assess what do we have in our communities in which we can assist, and some of the things you can look at, for example, in some of the workshops that we as a center have delivered, we have some really good folks that will come in and will deliver the word of what's going on in the native language, such as the promotora model. And some of those things are those assets that are in the community, people that are willing to go out there and say, hey, I want to be a promoter of health or want to get involved. In addition, sometimes you have professionals that are part of a certain community and they want to remain in the community. Again, these are called community assets, and that's just some of them. In continuation with the engagement, continuous improvement, and accountability piece, you know, with number 13, partner with the community to design, implement, and evaluate policies, practices, and services to ensure cultural and linguistic appropriateness. This is again another important piece, because here we're talking about how do we respond to some of the things that are being asked of us. As administrators, we write policies. We ensure that the way we're doing business is the way we're supposed to be doing it. I can't tell you as a monitor how many times that an organization will say, yeah, we have this and we do this, but it's on paper, and then you see that in practice it might not be the same thing. So how do you match both of them? They do go together, so those are some of the things. And again, I mentioned some of the agencies actually and organizations have gone forward and put a person in charge of such issues. But it's not just about having a person in charge, it's about making sure that the main person along with the line persons are able to ensure that they're doing what they're supposed to so that services are delivered appropriately and culturally responsive. 14, create conflict and grievance resolution processes that are culturally and linguistically appropriate to identify, prevent, and resolve conflicts or complaints. You know, one of the things that oftentimes is important is that people want to be heard. We have a lot of input that come in from those we serve. We conduct focus groups to make sure that some of this information that comes in our direction is something that is going to be helpful in order to guide us to write these policies, to write these procedures, to respond the way we should be responding. And again, it's not window dressing. It's not just on the surface. It's something that we want to make sure that people feel heard and are part of that information that's going to help us and allow us to go forward in ways that are meaningful. 15, communicate the organization's progress in implementing and sustaining CLAS to all stakeholders, constituents, and the general public. You know, one of the things when I originally started talking about CLAS standards in other places in which I've been employed, many of the organizations, I said, well, how does this affect us? Why us? Why is this so important? And part of it is not just about those that receive federal funds have to adhere to certain things. It's bigger than that. Because the thing is, this was a framework that was originally put together to serve as a guide for many organizations. Because the thing is, the changing landscape of the U.S. and how people that are coming in need to be served and that services need to be equitable is something that's not going to go away. So part of saying, so why us? Why should we do this? Is really something that needs to be asked of yourselves. And part of those that are in this workshop or webinar today, you probably asked yourself this, and that's for good reason. It's because you know that this is the way things are headed, is that we have to make sure that it's not just recognizing that the landscape is changing, it's also looking at how we can improve ourselves. If we're taught something in school, oftentimes that is a great framework to start with and it's a baseline. But once we get into the real job world, we see that some things aren't exactly as they were mentioned in school. So we modify and refine the way we do business to make sure that we're doing what we want to do, that we're helping how we wanted to help. We're serving the way we wanted to serve. So that's part of what I'm talking about when it comes to why us. And the thing is, that is, again, not going to change. It's more about how do we proceed from this point forward. I'm going to go ahead and open up for any questions, because the thing is, I think it's really important, because part of this webinar is to see, what are some of the questions that are going to be coming out. And since we're one of the first, is possibly the first organization or body to do this kind of webinar, I think it's important to see, what kind of things are coming up for people.
Oh, yes, Victor, thank you so much. One of the things that has come up from the participants is it required by the CLAS standards that the person that provides the services be of the same cultural background as the patient or client?
That's a great question. I like that question because I've been faced with it many times, and absolutely not. It's not. And here's the short and sweet answer. I don't know if there's a short and sweet answer, but oftentimes we make assumptions that if somebody's from the same background as somebody else, they're going to be effective in serving somebody, and it really isn't about that. One of the powerful pieces that we have as human beings is that we have the power to ask questions, the power to learn. So if I'm not from a certain background, I can ask the questions of, hey, tell me more about that. So we get to know that. So again, are there certain things that we're sometimes at an advantage because we know, for example, if I know the language with the person with whom I'm talking, that's a little bit of an advantage, absolutely. But again, if we're here in a helping position and we're willing to ask some questions of somebody, as long as we can serve them efficiently, somebody that is not of the same background has the capability to serve them well also.
Okay.
All right, Victor. Just for a moment, I'm gonna turn the presentation over to us before we continue with more questions. It's just gonna take one moment. All right.
Okay, Victor, we have a couple more questions. What do you recommend for the recruitment process to have a cultural balanced workforce?
Some agencies do different things, such as for the language. Some pay a differential for the language skill. And that's something that some organizations can do. Not all of them can do that. Others offer different things for such a skill. For example, some, if they can't pay that differential or that extra, we might offer a more flexible caseload, or say you have this caseload, so they might offer a more flexible situation. But it's not less work, it's different work. But just offer some things that are incentives to try to get some of this skill sets is part of your organization. So it depends on the organization and the situation. But if you want a diverse background, even if it comes to such, I'll call them simple, but really they aren't that simple. If you're looking for a particular group to be more part of your, make it so that you advertise in whether it's in a particular language or in a particular area of your town or city, and those kinds of things. In addition, I think that many organizations can do different things, such as offer, whether they're internships, partner with the universities or colleges, and whether they're internships for youngsters that are just finishing up, either with their associate, bachelor's, masters, or so on, and offer internships where people really get a feel for what they're doing, but they really get a flavor and a like for human service.
Okay, thank you, Victor. We have a couple more questions that are related, so I'm going to put them into one. Are there any implications on confidentiality regarding translation with patients? If you have an interpreter, how does that affect confidentiality?
Part of hiring interpreters, part of that is the confidentiality piece. Is they're professional interpreters, and they're part of the mix when you bring them in, whether it's telephonic interpreters or face-to-face interpreters. And those things it's important to take into account, because agencies hire interpreters. They're part of the staff. And if they're contracted interpreters from the outside, there's a service agreement. There's an understanding. So part of that is that they're considered staff.
Mm-hmm. So an idea would be, for example, to include that in the consent form, so that you can explain it to the patient beforehand, so they agree.
Absolutely. If the agency is very skilled at doing a utilization of interpreters, then part of what they're going to explain is, this is why we're going to use an interpreter, this is how we're going to use an interpreter, and the person gets to ask questions. But it's really important to let those that we're serving know how we're going to proceed.
Okay. Does the interpreter need to be certified? That's another question.
That's a great question, because some places interpreters are not certified, other places there are. There's different areas, whether it's the court or behavioral health, or where there's interpreters that actually become certified. So that's a great question. It depends on what area of the country you are in, and there's some places where they're already moving forward. They're more advanced than others in terms of ensuring that interpreters are certified. The courts are one of the areas where interpreters have are kind of more advanced, in that they had to adhere to something more specific, because the court language is a little different than other areas. So again, interpreters need to be not just aware of the language in which they're speaking, in which they're interpreting, but there's a jargon in which the different systems in which the different systems in which they communicate. So those kinds of things are really important.
Mm-hmm. Okay. So I think we don't have any more questions, but I want to thank you, Victor Flores, for today's presentation. It was excellent, and I would also like to remind everybody that an electronic copy of today's PowerPoint and audio will be available at the National Hispanic and Latino, at the ATTC Network website, so you can see that. Also, after we conclude today's webinar, I'd like to invite you to join us for July's webinar, which will be presented by Dr. Esther Calzada. She will be doing a webinar on Hispanic and Latino immigrant circumstances, stress and trauma, and its impact on substance use and mental health. So we'll be letting you know that that's going to be in July. So as you leave today's webinar, you'll be directed to complete a brief survey about your experience. So please complete this, and it's very important to us, and we appreciate you taking the time to tell us what you thought of today's webinar. So thank you, everybody. Gracias. Have a good day.
Gracias.
Thank you.